Hi. Hello. Hi, everyone. Good evening. Hi. How are you today? Hi. Hello. Hello. My name is Dr. Tosin Osikoya. How are you all? Thank you. Hi, Diana Haji, I suppose. Hi. Um, Boomski Smoothies. Hi, how are you? Okay. So I wanted to have this session to talk about first aid for common medical emergencies. My name is Dr. Tosin Osikoya. I've been teaching first aid for 6 years now, and I'm a doctor. I've been a doctor for like 22 years. So I wanted to kind of give it another avenue to teach people what to do in medical emergency, because not everybody can have access to either the time to come for a training, or even some people say it's the budget. I don't think that's necessary, but this is why I said I'll have an IG live session. So first of all, my apologies in advance if I don't do anything right. My first IG live session was about 4 or 5 years ago, solo, but I did one with Dr. Adanijo last year when I talked about collapse. I'm just trying to set this right. It looks, I don't know. Okay. So a bit about me. I've said a bit that I'm a trainer, first aid trainer, and it wasn't a career choice I made. Circumstances just made it that I decided teaching first aid because of a personal circumstance that made me see the importance. So I didn't set out to be a first aid trainer, but it's been okay because I think it's impacting on people, how they react to medical emergencies, especially in Nigeria. So can I know your names? Can you put it in the comment section, your names and where you're coming from? You already know I'm Dr. Tosin Osikoya. So that would be good, so that I can know who it is that I'm engaging with here. Okay. So Levande means alive or living, staying alive in Swedish. And it informs the basis of why we do what we do at Levande. It's giving you the knowledge, the skills, and the tools to help somebody stay alive in a medical emergency, to save lives. Yeah, so it informs all the things we do, whether it's a first aid training. Olubumi, hi. It informs all the things we do, whether it's first aid training, whether it's first aid kits that contains the items you need in a medical emergency, or even evacuation equipment to ensure people are removed from the scene of an accident safely. Now, I did say this would be a Q&A session for those of you who have questions about the common medical emergencies. Diana from Iraq, nice to meet you. So I did say that I wanted to, kind of dispel any myth about some first aid, especially because in our country we don't really take it seriously. We're kind of reactive, and people might have ideas all around the world too. So this is going to be a Q&A session, but I know that some of the questions may not come up, immediately. You may not just have an idea of, oh, this is what I wanted to ask. So I'm just going to say a few things, and if any questions come from that, then it will be good. So I'll just talk about some common medical emergencies and what you should do. I apologize also. I did say it's going to be for the 5-minute session, but something has come up, so it's going to be a bit shorter than that, but I'm sure we'll gain something from this either way. So first of all, what is first aid? First aid is the help given for somebody who is sick or injured before medical help arrives. It tells you, first of all, that you are not medical personnel. You are lay people with limited medical knowledge. So you are not supposed to do something heroic. Basically, it's just things to keep the person stable until the professionals come. Now, help, sickness help for sickness or help for injuries, because those two things are different. An injury is something external, so you have a cut, gunshot, a knife wound, or something fell on your head around, trauma. And sickness can be something that starts within you. So either which way, there's first aid for both. Now, why are you doing first aid? What's the aim? First is to preserve the life of the person. Preserve the life means keep this person alive until medical professionals come. There is limited or minimal possibility that in a medical emergency, professionals are outside your door. So it's going to take some minutes to get to you. Now, wherever that might be, whether it's for a loved one, for a stranger, in the time it takes to get the emergency professionals to where you are, you need to be doing something to keep the person alive. If, like, your reality is like in Nigeria, that the ambulance may not come to you fast enough and you want to transport this victim to the hospital, you also need to keep them alive, because when you get to the hospital and this person is not alive, there is nothing. Whatever the sci-fi movies tell you, whatever those medical movies tell you, and TV shows, there is nothing they can do to keep this person, to bring this person back to life. So the more you do to help that person stay alive, the better. So that's the most important aim of first aid, learning first aid. The other one is that it helps you prevent a condition from worsening. So if somebody is bleeding, having a fracture, what you do at that scene or to help that person can prevent that condition from worsening. And it leads on to the third aim, which is it promotes recovery. So obviously, if you do something to preserve the life of the person, that means you keep this person alive, you also prevent the condition worsening, then it's obvious that you're going to ensure that this person recovers faster, to return either to their job, for the child to return back to school, first aid can save lives. So that's why you're learning first aid. Now, I'm going to talk about the fact that in a common medical emergency, starting from the home, for instance, the home is the most dangerous place for a child. So please, and I want to say that if you have any questions, please put it in the comments. Like I said, this is my first time doing an IG Live. I'm not sure how it works. I think there's a question button there. I think you're supposed to tap it and write a question in, and it's posted and I can say it. So if you have any questions, please ask, and I'll do my best to answer them to the best of my ability. But we're only talking about first aid for common medical emergencies here. Now, the first thing I would say is that please, prevention is better than a cure. Now, yes, despite the best of your intentions or what you do, some people might still be hurt. But you limit the chances of somebody getting hurt if they're also practicing safety measures. Like we say, safety is first aid for the uninjured. So if somebody is practicing safety, you're doing things safely, like for in the house, you're removing all the hazards, a child won't choke on beads or little toys that are not supposed to be for her age or his age. You're not leaving a child unattended in the kitchen and there's a hot pot of hot water on the fire or a kettle. You're not being on Facebook and the child goes over the balcony because they're not paying attention. So all that is important in keeping a child alive. You want to prevent there being a medical emergency as much as possible. So safety, prevention is your best bet. Yes, you can do all you can and still have a medical emergency. Yes, I agree, but at least we limit it. The other thing I was saying earlier is that the home is the most dangerous place for a child growing up. For a child till he or she is about 5, they have no idea of what is around them, what is causing them harm, what can cause them harm, what can injure them. They are only about playing and having fun and sleeping and doing what children do. So it's left to you to make sure the environment in which they are staying is safe for them. So you're talking about light, can they see properly? Is there any nails unattended? Is there water spills? Are the doors closed? Are the bathrooms closed? If you have a pool, is it gated already? All the things you can do to ensure that it is a safe place for the child to grow up. And as the child grows older, you adjust the safety measures because it has to be age appropriate. And when they go to school, those in school should also know what to do to keep the children safe. Now, there are 3 stages of prevention. So primary, secondary, and tertiary. At each stage, you want to limit the chances of things getting worse. So let me talk about a few first aid myths, especially in my home country, Nigeria, what we practice here, that is, that we are either doing it wrong and can cause more harm. The first thing I would say is that, and I repeat, you are not medical professional. So there's a limit to what it is you can do in terms of diagnosis. You're not to make a diagnosis of what has caused the problem. You're just to help this person stay alive. The other thing is that in terms of you're not like I was saying, you're not medical professionals. Yes, you also must know that the earlier, if the person needs medical care, the earlier you get the medical professionals, the better. So for instance, now somebody collapses, is unconscious and not breathing. There's limited things you can do to keep this person alive for over the long term. You just have a short window in which to do what you can, and the person needs medical care. Especially if you don't even have an AED, you would do CPR, yes. But how long can you do CPR for? You get? So most of the times what we teach you is that if you already recognize the emergency, the earlier you call for medical help, either the ambulance is coming to you or you are transporting this victim there, the better. Because if you do not get them there alive, there's limited chances of them helping. So I'm going to talk about a few things we do. So in Nigeria, for instance, we have this common thing that if a child has a cut, anybody has a cut, you put methylated spirit on it. That's not ideal. First aid shouldn't hurt. So if you're going to put methylated spirit on an open wound, it's going to sting, it's going to hurt, and it's actually killing the cells that can promote healing. So it's not ideal. What you should do is actually wash that. If it's a small cut, go and get clean water, wash it, get your first aid kit, dab it with a sterile pad. If they're still bleeding, then put a plaster on it. The plaster acts as a form of pressure to stop bleeding. So that's for a cut, and that's the same thing for a scrape. If it's a bruise or a swelling, ideally whatever the child or the adult is doing, they should stop. They need to rest because the body has suffered harm. So then put ice on it. If you don't have ice, get a cold bottle of water and place it on it. What that cold does is bring a kind of relief such that the person is not hurting, it's not in pain. And that is helpful for that child, if it's a child, to feel calmer and know that you are doing something to help him. If it's an adult, you can recover faster and get back to work. Okay? Now, another thing that we do wrongly here is that if somebody has a seizure, we put a metal in their mouth, like a metal spoon. I don't understand the reason why that is done, but it's harmful because the seizure in itself, while looking very horrible, terrifying, is not doing anything to that person. The seizure is just like an electrical activity. So take for instance the bulb, and the voltage is wrong and it's just going back and forth and flickering. That's what is happening in the brain. And after a while, it will stop. What you're supposed to do as a first aider or to help this person is not for any harm to come to him. So sticking a metal spoon in their mouth can break teeth. It can cause cuts in the mouth. Restraining them from having that seizure can tear muscles. You do not have to stop the seizure. What you have to do is make sure, if for instance was outside and there are stones nearby, remove anything that can harm that victim away from them. If in the terms of having that seizure, he's hitting his head on the floor, put a cushion under his head so that he's not traumatizing that head. Whatever you are doing is try to minimize the harm that will come to that person after the seizure has stopped. And it will stop. Then what's the person left with? Cuts, bruises, bumps. He won't thank you for it. Now, yes, seizures don't last that long, but some do. And if it's persisting for more than 5 minutes, if you timed it, then go to the hospital. But outside of that, for first aid, all you are going to do is make sure there's no harm coming to that victim while it's having that seizure. So another thing so that's for seizure. So I've talked about cuts and scrapes. Water is fine. No need for spirit, no need for TCP, nothing is needed else, nothing else is needed rather. Once it's clean with the water, please put plaster on it and that's fine. I talked about seizures, that you don't need to do anything to them to stop that seizure, to restrain them, or to even whatever you do, you are trying to make sure there's no harm, no trauma coming to that victim. Once the seizure stops, and it's the first time, that they need to go to the hospital. But at that point in time, do not worry about the saliva or anything. It's not going to cause you any harm. There is no stigma. It's not contagious. The reason being that seizure is just a symptom. It's like saying somebody has a fever. Fever just means that the temperature is high. So seizure just means there's an electrical activity. I'm not asking you what caused that seizure. You're not making a diagnosis. The medical people will make that diagnosis. It could be from epilepsy, a tumor, anything at all. But at that point in time, that seizure activity needs to be, the victim needs to be helped. Now, if there's a burn, burns could be from dry heat, that is fire, from wet heat, that is a scald. Like I said, if you have any questions about any first aid needs, practices, any questions, please put them in the comments or put them in the questions. I will answer them. I'm just talking about a few things you can do in common medical emergencies, and it might, ring a bell that, oh, I have a question about this. Oh, they do this way where I am, and I can, either correct that or we can learn from each other based on that. Okay. So I was talking about burns. Burns can either be from dry heat, a wet heat, is scald, from electrical activity, what do you call it, the voltage, yeah. Or the fourth one is like chemicals. Burn is born to the skin. Something has gotten onto me, that's the skin is talking, and it's hurting me, it's burning me. Whatever cause it is, it doesn't care. The way you're going to manage it is the same. The first thing, obviously, is to remove the source of that burn. So if it's a dry heat, obviously it's a fire, you should put out that fire with a blanket. But for first aid here, I'm talking about, small fires, small burns from in the kitchen, or maybe a child was left unattended to hot tea and all that, or an electrical activity from a exposed wire, or even a chemical. So the first thing is to remove it. So if it's chemicals, lots and lots of water. That's why if an acid attack, you also put lots and lots of water. It's burning. Water, copious amount of water. You want to limit, remove as much as possible the chemical. The fire, you want to remove the source. So the electrical wire, you want to remove the person from the source, first of all. Now, after that, you please make sure you add, if it's a small burn, place the person's, the area that has been burnt under running tap water. I didn't mention cold water. I didn't mention ice. I didn't mention honey, aloe vera, any of those things, pap, egg. My fellow Nigerians, none of that is what you should be doing. There's a similarity to what you are doing, kind of effect that's coming, and that's from that coolness. You see, when I ask you to, in the burn for 15 to 20 minutes, place that, in fact, the recommendation now, because first aid is that there are always new guidelines. It was 15 to 20 until last year. Now they're saying at least 20 minutes under running tap water at the room temperature. So if your house is such that it doesn't have running tap water, then get a bowl of water, let the person place the area that's been burnt in it, and change it. Now, what happens is that you are stopping the cooking. So all of you that are chefs, you know that if there are some meals you're cooking that after it's just nearly done, then what you do is get that meal off the fire, and it continues to cook in its own heat. That's what the fire burning is doing. If you don't stop that burn, you don't cool it down immediately, the cooking is continuing, or not really, but it's continued deep into the tissues, and you want to avoid that, because the deeper the burn is, the more the complications that can arise. So the cooling does two things. It gives you relief, because the coolness on your skin limits the pain that the person is having. And the other thing is that it stops the cooking. So You can't see the heat, you can't feel the heat, but it's really going in, and that continued water that the person is putting under it on it would reduce that. Like I said, hi everyone. If you're just joining, didn't I pin the comment? Okay. Like I said, sorry, this is my first time of doing IG Live. I'm not very conversant with it, but I think I'm doing okay. So if you're just joining, thank you for coming on this live. I'm just talking about some common first aid for medical emergencies, first aid for common medical emergencies. And if you have any questions, please put in the comments, or there's this question button I think it's supposed to use. So okay, so I'm just talking about some common things that it might spark a question for you, and I would be able to respond to that. So I was talking about burns. So the first aid is cool it under water for, thank you Boomski Smoothies. The first aid for burns, no matter the type, is to cool it under water for 20 minutes at the minimum. And after that, you wrap it in a loose bandage, because you're not sure, that area is still sore a bit. So there is burn dressing in some first aid kits, or you can wrap it in what we call a burn dressing. It's kind of like a loose wrapping, and that's it. Later, you want to use aloe vera. Please feel free. You want to use honey, because I worked in a burn unit at one time, and honey is actually a way to help burn heal, but it's not first aid for a recent burn. Now, please let me explain this to you. Some people do something else and it works for them, but that's survivor bias, that it worked for me to work for somebody else. Number one, we're not talking about the same amount of intensity of heat, or the same duration, or the same skin type probably. So first aid is general for all, is that you put it under water. Why pap can work, or why egg yolk can work, is because there's an initial coolness, so you feel there's a relief, but actually in the long term it can actually cause scarring. Okay, burns is water. Water is your best friend actually in first aid. So that's that. No questions. I want to talk about bleeds. That's another common medical emergency. So when you have a cut is just something small, there's also punctures. Puncture wounds is that the nail goes in. Now, the general thing is that if you had a puncture wound outside, you need to take after cleaning it, you need to go and get tetanus toxoid if your tetanus toxoid is not up to date. Your tetanus toxoid injection, and that's supposed to be worried about it, because the way the bacteria that causes tetanus, it goes deep inside. It likes dark, moist areas, so you want to prevent that happening if it is. But if it's in your house and you had a cut, there's no reason, because it shouldn't be dirty, so you clean it normally. That's for a cut. But if you have a deeper wound, a bleed, a severe bleed, now I'm not talking about a life-threatening bleed. I know we've been having horrible stories now with tanker trailers falling somewhere, God knows whether it's decapitating and all those, or gunshot injuries. We'll talk about that later. I'm just talking about a severe bleed. Maybe you're walking and you didn't know there was glass and you walked through it. Okay, so it's a deep cut, a deep gash. The first aid, your first thing to do is to apply pressure to stop the bleed. Now, the blood you have in your body is supposed to be going around, circulating, carrying oxygen around. It should be in the pipes. Okay, I call it pipes. So those, it should just keep on going there. I don't want your blood out on the floor. It's not serving any purpose there, because the main reason why it exists is to carry oxygen around. So if all the blood is flowing out, then what's carrying oxygen to your organs? It's going to die anytime soon. So your first thing is that I want to keep this blood within the pipes in my body. So you're going to apply pressure. Now, when I always say pressure, it always seems odd to you. Pressure just means, so for instance, I have a wound, a deep bleed here, a very big gash here, and it's bleeding profusely. I don't even need to worry about asking someone to get the first aid kit. I would first of all put my hand there to kind of stop it, at least stop the flow for what at that point in time. So somebody can get a clean cloth if you don't have a first aid kit and put it on it. At this point, I'm not worried too much about infection as opposed to a bleed. You can bleed out from a severe or life-threatening bleed in 3 to 5 minutes. That's serious. So infection is the least of my problems when you're already dying. But in a, I don't expect in your house is such a severe bleed. Sorry, give me a second. I have to check the time. Oh, okay, good. I still have a few minutes. So in a severe bleed, I need to apply pressure. Pressure means I put my hand or apply pressure, a firm force on the area that is bleeding, right? To stop the flow out. And it also, over time, helps the blood clots to form. So it forms a plug. I need a plug. I need, the hole is there. I need to plug it so that the blood doesn't flow out. Then if you get your first aid kits and you have one, which you should have, apply pressure to with your sterile gauze. So that's it. In a severe bleed, it's a bit more serious, and I don't want to get into what you do for that. And another thing I want to talk about is the collapse. It's what I talked about last year, and it's something that tells you that life is at stake here. So a collapse is that somebody became unconscious, and it could be breathing or not breathing. I talked about this last year. So before I talk about collapse, are there any questions? I don't know how many people are on this live session, but if I'm very clear, that's very good. If I'm saying things that make sense to you, I'm happy about that. And then if I'm not, or you have any other question or something else I may not talk about, please put in the comment sections or ask this button here. Okay, so I want to talk about a collapse. Now, that's just a word. Person collapsed. It means nothing to me. Okay. It could mean faint for some people. It could mean something hit him and he fell down. It could even be love struck and he fell down. You understand? So you don't just get in the panic because you heard somebody collapse. Your thing is this: if I'm there and with that person, what can I do to see I can help him if it is life threatening? So I know first of all, people would think, oh, I need to be running and do something. No, you have to make an assessment. First of all, there's a mnemonic called the First Aid Basic Plan, Doctors ABCD, DRS ABCD. Now, D is for danger, R is for response, S is send for help, A is airway, B is breathing, C is CPR, and D is defibrillation. Okay, so that plan called the First Aid Basic Plan is the step-by-step action you should take at the scene of such an incident. So whether it's at a party, and I must tell you, a lot of people are collapsing, from athletes who you think should be the most fittest to anybody. I know a young teacher who collapsed and died. I know, I still did a CPR training for these footballers, kind of like in their 40s, and a friend died on the football pitch. So it's quite common. Does it mean that they have to die? No, it's not fated that they have to die. It's fated if the decision you took to help them didn't work out. Okay? So for instance, you don't know CPR, you didn't take them to the hospital on time, then it's likely the person will die. So that will have been fated because of that decision, the consequence of that decision. So let's talk about what you need to do. So I said doctors ABCD. So first of all, why this danger? You're checking for danger. Is there any danger to me helping this person, especially if you are not there and didn't see why you are not part of why the person collapsed? You didn't see why. So you want to be sure, is there anything around? Is there any funny smells? Is there water on the floor? The person sleep? Is there any electrical cable? Did anything happen to have caused this collapse that I can see in the environment? Because you know that if there's an electrical cable, like NEPA cable, it shouldn't get into that place no matter what. That's deadly. So that kind of one, you need to call the professionals for that to come and see what they're going to do there. So you need to be sure so that you don't end up becoming a victim too. And if you're the only person that can help the initial person that collapsed, then who's going to come and help both of you if you're the only two? So check for danger, make sure it's safe for you to help this person, then go in and check, okay, this person collapsed, or I'm seeing this person lying down. And remember that it's not only on the floor. People can collapse in their chair, they can slump in their chair, they could slump standing up. If it looks odd to you, find out by, after checking for danger, response. The response is not to slap the person or pour water on them. I beg you, please. I can't go into the reasons for that. I can only expand on that in the training. But the response is to see if this person would show you the signs that he is alive. Now, how would you know somebody is alive or is conscious? He will open his eyes. He will talk to you. He will say, leave me alone. He will move his hand. Something that tells you. So that's a response. So you tap his shoulder, okay, or you call his name if it's a friend. If he's conscious, he would respond to you in any of those ways I have listed. And if he doesn't, then you know something serious has happened. The next thing is S, send for help. I go into detail on what send for help means in trainings. But please know it's not just shouting, Aradugo, help, help, help. Nobody's going to answer to that, especially, for instance, I always say in a workplace, if you're keeping malice with your co-worker and you just start shouting, Shala, Shala, excuse me, Shala will hear and say, who's that one calling me? Who asked him after he shouted on me earlier? So it's not just shouting help. There should be a purpose behind it. You should communicate the urgency. The person should understand that and come and get you. Abroad, they'll tell you call 911. That means you can call 911. But that's not a reality in Nigeria. I hope you know the emergency number for Nigeria. It's 112 if you don't. For Lagos, it's 767. In training, they're always asking me, does it work? Yes, it does. Of course, you understand our reality also is that it could be traffic, it could be something else. So you should also have to make plans for your own evacuation. But that's by the way. So you send for help. You want, am I calling the emergency medical services? If it's my office, do we have an emergency plan? Am I supposed to call this particular doctor? Is this the clinic doctor? Am I, is there someone on retainer? You must have a plan beforehand, because I promise you, if the emergency happens and you don't have a plan, you will panic and it will lead to more dire consequences. So you're watching this now, have a plan, whether it's for your home, for your school. What am I going to do? What should anybody do if they see this kind of thing happen, whatever the medical emergency is? It's not shouting around the person that's going to make a difference. It's getting them medical help. So you check for a response, you send for help, you now come, check the airway, listen for breathing. I'm just going to show the steps or tell you the steps because it's a practical training. And you listen for breathing. You need to be sure this person is breathing abnormally or not at all before you start CPR. CPR, cardiopulmonary resuscitation, is a skill, is a technique that you must do appropriately for it to make sense, to help the person stay alive. It must be high quality, so it's a lot of things to it. It's not just pressing the chest. It's how often am I pressing? There's 30 compression to 2 breaths. Must I breathe for this person? If it's a family member, yes. What you don't have to breathe for somebody if you do not have a barrier, at least to prevent the person infecting you or you infecting the person. Compression only, also called hands-only CPR, works because you do not extract oxygen at one go. The body takes some, it goes around again, it takes some, and that's why you need to call for help as soon as possible so professionals can be there. Okay? So you continue CPR for as long as you can until help comes, the person is resuscitated or you're exhausted. You can't say the person is dead because you are not a medical doctor. Only doctors certify people dead. So I hope that helps with some common medical emergencies that I've talked about. We talked about cuts and scrapes. We talked about seizures. We talked about burns, pressure for bleeds, very important, and collapse. Somebody is breathing. Somebody is unconscious and not breathing. How to recognize that the person needs CPR and begin the CPR. One more thing I want to talk about in helping somebody is that please understand that for you to do first aid on somebody, the person needs to give you consent, because you understand that nobody has rights to your body except you. Now you might be wondering, oh, consent, why? The person is sick, I want to help him. The person is dying, I want to help him. Yes, I understand that, honestly. But you have to understand that the person has authority over his own body, or her own body. And consent is not saying, oh, give me permission to do this. No, consent is saying, my name is Dr. Osikoya. I want to be able to help you. I can see you are bleeding. Is it okay? The person will say yes. But you just don't go in and start slapping the person and beating the person and tell the person, sit down here, you two, why did you do this? That's wrong. Because if you see somebody, or if you've ever been in a position where you were injured, or you were really ill, it's a very vulnerable place. It's a very vulnerable time. You're confused, you're in pain, And the last thing you want is somebody that, you know, one stranger of the road just hitting you or shouting on you. You want to be reassured, you want to be comforted. And if the person does it right, you would say yes. Now, if the person is unconscious, is the person going to give consent to? Yes. In helping somebody who is unconscious, it is implied that the person is rational, and if he will talk to you, he will tell you, please save my life. So yes, consent is implied before you do something to help somebody. Okay, so I think this is what the most I can do for now. I wanted it to be a Q&A session. I didn't get any questions, and if there's in the next few seconds before I leave and there's a question, that's fine. So I think I'll be able to save this video. I hope. I'm not sure. As I said, this is my I haven't done IG live before, so I hope I can save this. So if you see it later and you feel you have any questions, let's put it in the comments, either in the video or here before I leave. So if there's no other thing, I'm only going to end by saying learn first aid as much as possible. If you can make it a practical class, that would be great, because what you're hearing, what you're saying, honestly is way different than when you're doing it. Okay, so if you ever have the time, make it an awareness thing, get everybody together, just learn what it is to do. You'll be surprised how much of a difference it can make for yourself, for loved ones, or even a stranger. The other thing I want to say is that please think of prevention being better than a cure. Always practice safety. Do not be in a rush to do anything. Remove hazards and plan for hazards that you cannot remove. Have a well-stocked first aid kit. Maybe one day I'll talk about first aid kits and all the misconceptions people have about first aid kits. And yeah, that's it. So I think if there's nothing else, I've covered what I wanted to talk about. And thank you very much for joining this live. Like I said, my name is Dr. Osikoya. I'm a first aid trainer at Levande Healthcare. And what we do here is give you the knowledge, skills, and tools in order to help someone in medical emergency. Thank you very much and enjoy the rest of your day. Bye.